India is reeling under the repercussions of day 4 of a nationwide lockdown to counter the spread of the contagious coronavirus. And the big concern right now is a shortage of ventilators, which are critical for addressing pneumonia, a primary cause for mortality among COVID-19 patients. And it is estimated that India has only about 40,000 ventilators at present, about 8,500 or so of them only in public hospitals. This is a war we're in, and for a war where each and every one of us has to pitch in, whether it's just simply staying home under lockdown or even being on the front line if you're a doctor or a healthcare worker. And for its role in combating the COVID-19 crisis, we have joining us now Dr. G. Satish Reddy, the chairman of the DRDO, that is, of course, the Defense Research and Development Organization. Thank you so much for joining us. So first and foremost, Dr. Reddy, with ventilators emerging as the biggest need of the hour, now the DRDO is stepping in. How?
Basically, DRDO has developed a ventilator a couple of years back. And this ventilator, which has been developed with a biomedical society and along with an academic institute, has been transferred to industry. And over the years, the industry has upgraded it and has been producing and has been even exporting it to a couple of countries. Now, that particular ventilator has got some problems with respect to some of the availability of some of the components. And last 10 days, our scientists in the laboratory called DEBEL in Bangalore have worked on it, developed those parts, worked with industry, and identified them to produce in numbers and supporting this industry. Now, also the DPSU, the Defense Public Sector Unit, Bharat Electronics Limited, has also joined hands with this industry, and together they should be able to produce large numbers now, along with these components which are coming from the small-scale industries. And my feeling is roughly in the next about 3 weeks or so.
3 weeks,
or
I was just going to ask you that, Dr. Reddy, because as of now, the numbers stand at 873 cases in India at the time of us doing this interview. That's almost 150 in numbers. When talking about numbers, that's 150 increase in 24 hours. So the big question, of course, is when will this be available?
As I said, about in 3 to 4 weeks, there should be about 5,000 numbers should be available. And from there, the confidence is there with the industry that they should be able to scale it up to about 10,000 per month. And the industry has also expressed its willingness and are already discussing with a couple of other industries who can produce this ventilator and trying to transfer the technology free of cost. If these industries also can take up this and produce, which we are in touch with many of these industries, then it can be scaled up to more than about 25 to 30,000 ventilators a month.
All right.
And
Dr. Reddy, so many interesting points you are mentioning. I want to go through each and every one of them one by one. You keep saying industry. Can you give us more details? What do you mean by industry? Who will make them? Because DRDO has come up with the design and the components which you have said that weren't available because I'm guessing, of course, imports of these components and other medical equipment all had been disrupted by the ongoing international lockdowns due to the pandemic. So who will make them now? DRDO obviously can't produce them. You're not a manufacturing hub. So when you say this, the sector, who are you talking about?
The components, what I said, will be produced by the small-scale industries which you have identified in Bangalore, Coimbatore, Mysore, and Hyderabad. And those people will be producing those small components and supplying to the industry.
Fascinating.
When I said as a ventilator industry, when I said there is an industry in Mysore which actually is producing this ventilator.
Yes.
Now Bharat Electronics Limited has joined hands. Bharat Electronics Limited will be producing the complete electronics part of it, and then together they will be producing this large number. And I said once again that this industry is in discussions and also giving training to a couple of other people, couple of other industries free of cost. And those industries like Ananda Mahindra,
Correct.
if when they come up with this knowledge and get into real production, then the numbers will go up. As you rightly said, DRDO is only technological supporter and technological organization which will be designing only and make these industries give the necessary support and make them produce.
All right. So, you know, the move to invite corporates to make these ventilators has also been experimented with in the US. But I want to go back to the original big story. There have been reports. Can you confirm this, that what the DRDO is actually making, which would be the path breaking? Do we still have Dr. Reddy? Is that this would be a multi-patient ventilator. Let's try and get Dr. Reddy back on. Let me just inform our viewers who are just joining us. This is a critical announcement being made by the DRDO. All right, we have Dr. Reddy again, sir. I was asking you if you can confirm. There have been some reports that the DRDO is actually making a multi-patient ventilator. Is that true? Because that would be the big headline. And how would it work?
No, it is actually use the present ventilator, and we have developed a mechanism which can be used for multiple patients. In the sense, one ventilator, instead of for one patient, you can use it for multiple patients. This has been, in the last 2 days, has been tested in a couple of hospitals and with a couple of doctors, and it has been proven successfully. But this is only to be used as a last resort when we have large number of patients and we have shortage of ventilators. Then use that for multiple patients from a single ventilator. That's the mechanism what DRDO has developed and which will be through industry producing large numbers.
Dr. Reddy, may I ask, why do you say this is a last resort? Why is it that it can't be used?
Normally, till now, medical practice-wise, a ventilator is used for a single patient. For multiple reasons in the medical terms, in the sense, one patient has got an infection and then another patient has
another infection. And this is highly infectious. Okay, understood.
Yes, but we are also working on that also to completely isolate from patient to patient, inlet, outlet and all that. Probably that in the next 2 days, we should be able to come out on that also.
All right. And Dr. Reddy, how much would a unit cost?
No, this will be very small. This will be in a few thousands. This added mechanism should be in few thousands. This is made in additive manufacturing, and that should not be costing much at all.
Okay. Dr. Reddy, I have to ask you this question. I don't know if you are in the position to answer it, but I'm sure it's on everybody's mind. Why then, if it's possible now in a crisis, the DRDO is making this, we've gotten together a system where we're going to be making this in India. Why were we then importing these if they could be manufactured in India, sir?
But this industry, what I said, has been manufacturing already in India. And in fact, they have been exporting also. But I wouldn't be able to answer this question. I am not from the medical field. And we are supposed to be doing only the technologies for the defense. And as a spin-off, these things which we have developed with the knowledge what we have developed in the defense technologies. But this industry has been exporting to various countries. That much I can tell you.
Correct. Well, thank you, sir. At least you attempted that answer. But of course, thank you for your time. China, the epicenter of the coronavirus, of COVID-19 was China. And China, of course, was the undisputed manufacturing hub of the world with nearly 28% of share when it came to global manufacturing output. Now, the question, of course, is will this now lead to more Make in India products? That only remains to be seen. But thank you so much, Dr. Reddy, for your time at this critical point. Thank you so much.